I'm recording this on selfie mode, so left and right is going to be reversed. Okay, knock knock and hygiene. Hello, my name is Uzi. I'm going to be your nurse practitioner today. We're going to be conducting a neural exam. Do I have your permission to record?
Yes, you do have consent.
Okay, and then are you 18 years of age?
Yes, I'm 18.
Perfect. Okay, so the beginning of the Neuro Exam is the test of cognition. So I'm going to ask you a series of questions. Please answer to the best of your ability. Okay, so can you tell me who you are?
Excuse me, I'm Zion.
Okay, perfect. And then where you are.
I'm at the clinic.
Okay, and do you know the date?
June 18, 2023.
Perfect. And then do you know why you're here?
For a wellness check.
Perfect. Okay, so the patient was alert, oriented, ×4, person, place, time, and situation. Okay, now can you tell me, so we're going to be testing for remote and recent memory. So can you tell me what is the first school that you've ever gone to?
Verde Elementary.
Okay, a little louder.
Verde Elementary.
Perfect. Okay, then we're going to ask who is the president?
Joe Biden.
Perfect. So remote and recent memory is functional and intact. Now we're going to be asking, okay, for reasoning. So if you have to urgently get to the other side of a street from a sidewalk, what would you do?
Check both sides of the street before crossing.
Okay, perfect. So the level of consciousness of the patient, I will see, is alert, oriented, he's attentive, his speech patterns are clear and appropriate, there's no signs of stuttering, no signs of confusion, or any type of disorientation. Noted? Okay, so after conducting the cognition test, we're going to be moving on to the cranial nerves, okay? Alright, so starting with cranial nerve number 1, we're going to be using the Snellen chart. Okay, stick your hand out. Okay, so this, I ask him to stick his hand out. And then I place the Snellen chart to my chest, which is about 6 feet from his eyes. With corrected vision, please tell me what the lowest line you can see.
L, T, F, P, H.
Perfect. So with the Snellen chart, his vision is 20/20. Okay, now we're going to be moving on to the ophthalmoscope exam. Okay, so I'm going to be flashing this eye to look at your eyes. Could you take off your glasses for me? Okay, so I will assess the patient's right eye with my right eye. Okay, I see the red reflex. Okay, I see the lens is clear and intact. I see the pupils are clear. I see the optic nerve. I see the optic disc. Okay, and I see the blood vessels. The disc to cup ratio is 2:1. The optic vessels are clear and intact. There's no signs of papilloedema, no signs of hemorrhages. Okay, sorry. And red reflex is noted on that eye. So now I'm going to do the same thing to the other eye. Okay, all right. Red reflex noted. Okay, lens is clear and cornea is clear and intact. Okay, hold on 1 second. Optic disc to cup ratio is 2:1. Okay, blood vessels, the blood vessels are functional. There's no clear. There's no signs of papilloedema, no signs of hemorrhage. They're fine. Okay, fine, and no signs of corrosion. Okay. All right. So then now we're going to be assessing for pupillary response. Okay. You can just look at my ear. Okay. Cover one eye. This will also test for any signs of abrasions or any type of damage to the optic eye. Okay. Sorry. Don't cover your eye. Okay. All right. So look at the light. Okay. So with direct light, the pupils constrict. Okay, now I'm going to look at the opposite eye. Okay, the opposite eye also constrict equally, so they're both equal. And of course, the pupils are round. Right? Now I'm going to assess the opposite eye for direct light constriction. Okay, the eye constricts. Now I'm going to be assessing the opposite eye for non-direct light constriction. Pupillary constriction. Okay, so the opposite eye also constricts, so the pupils are equal and reacted to light, both directly and non-directly. Now I'm going to be testing for accommodation and convergence. Okay, so we're going to, you're going to follow this, okay? And I'm going to put it closer to you, face. Okay, I see the pupils constrict, and then as I bring it out, the pupils dilate. Perfect. Okay, so now we're going to be testing your peripheral vision. Okay, so cover one eye. Okay, when you feel when you see my fingers wiggling, tell me to stop.
I see.
Perfect. Other side.
I see.
Perfect. Both eyes.
I see.
Perfect. So peripheral vision is functional and intact. The pupils are equally reactive to light. They're about 5 millimeters. Okay. They accommodate. Okay. So optic nerve is functional and intact. So now we're going to be moving on to cranial nerve number 1, olfactory nerve. Okay. Close your eyes. Occlude one nostril. Smell this.
Mints.
Okay. And then smell this.
Alcohol.
Perfect. So cranial nerve number 1, olfactory nerve is functional and intact. Cranial nerve number 2, optic nerve is functional and intact. Now we're going to be assessing cranial nerve number 3, cranial nerve number 4, and cranial nerve number 6, which are oculomotor, trochlear, and abductor. Okay. All right. So same thing as last time. You're just going to cover one eye.
Okay.
And then you're going to follow this.
Oh, okay.
Okay. All right. Perfect. Cover one eye.
Oh, sorry.
Okay, perfect. While he's doing this, I will also be assessing for nystagmus, any types of laziness towards the eye, any types of lateral drifting of the eye as well. Okay, so superiorly, cranial nerve number 3, inferiorly, cranial nerve number 3, medially, cranial nerve number 3, superior medially, cranial nerve number 3. Now inferior medially is going to be cranial nerve number 4. Perfect. Now superior laterally, cranial nerve number 3, inferior laterally, cranial nerve number 3, and then laterally is going to be cranial nerve number 6. Perfect. All 3 cranial nerves are functional on that eye. No signs of nystagmus, no signs of pupillary drifting, no signs of any abnormal eye movements. Okay. Now same thing with the other eye. Okay. Follow this with your eye. Okay. So superiorly, cranial nerve number 3, inferiorly, cranial nerve number 3, medially, cranial nerve number 3, superior medially, cranial nerve number 3, inferior medially, cranial nerve number 4, laterally, cranial nerve number 6, superior laterally, cranial nerve number 3, and inferior laterally, cranial nerve number 3. So cranial nerve number 3, 4, and 6 are functional and intact. Again, they are oculomotor, trochlear, and abducent. Now we're going to move on to cranial nerve number 5, which is the facial nerve, which is, the trigeminal nerve. Okay. I'm going to be using this pen as a sharp and the cotton tip as a dull. Please tell me if you feel them. I'm going to be touching the temple, the maxilla, and the jaw area. Okay. So.
Blunt? Oh, sharp.
Dull. Dull.
Oh, dull. Sorry,
Yeah,
dull.
no blunt. Dull.
Sorry.
It's all good. Okay, try feel that again.
Okay, dull.
Oh.
Dull.
Yeah,
Dull.
that's fine.
Okay.
Okay.
Sharp.
Perfect.
Dull.
Perfect.
Sharp.
Perfect.
Dull. Sharp.
Perfect. Okay, now the opposite side.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Perfect. Okay. Now I'm just going to see, try to open your mouth. Perfect. So TMJ is functional, no signs of popping, no signs of difficulty when he was opening his jaw. Cranial nerve number 5, trigeminal nerve is functional and intact. Now I want you to frown. Okay, perfect. And then smile. Okay, perfect. So cranial nerve number 7, facial nerve is functional and intact. No signs of unilateral drooping, no signs of struggling when he was trying to smile or frowning. Both sides of the face was symmetrical. Okay, now we're going to do cranial nerve number 8. So we're going to first start with the Weber test. Basically what I'm going to do is put this on your forehead and then tell me if the sounds are equal on both sides. And then I'm going to move your hair for you out of the way.
They're equal.
They're equal, both of them? Okay, so Weber test displays bilateral equalization, sound equalization. Okay, now we're going to be doing the Rhines test, where I'm going to be placing the tuning fork on the mastoid muscle, okay, on the mastoid bone. Tell me when you stop hearing it.
No.
Okay.
No.
Perfect. Okay, now we're going to do the same thing to the opposite side.
No.
Perfect.
No.
Perfect. So sound sound conduction is 2 times air conduction is 2 times bone conduction, which is a normal finding in the Rhines test. Okay. So now we're going to be doing the whisper test, which basically, as it sounds, I'm going to whisper to you. I'm going to ask you to turn around actually, and I'm going to whisper, and you're going to occlude one ear. Okay. And then you just tell me what you hear. Okay. It's going to be a 2-syllable word. Okay. Occlude one ear.
Like this?
No. So place it right there. Perfect. Okay. So rainbow.
Rainbow.
Perfect. Other ear. Baseball.
Baseball.
Perfect. Okay. So the whisper test is functional. All 3 tests were functional. Therefore, vestibulocochlear nerve cranial nerve number 8 is functional and intact. Now we're going to be assessing cranial nerve number 9 and 10, which is hypoglyceo and vagus nerve. Okay. All right. So I'm just gonna have you say ah.
Ah.
One more time.
Ah.
Okay. The rise and fall of the uvula is noted. Okay. Now I'm gonna have you swallow. Okay. And then I would check for gag reflex with a tongue blade. Okay. So cranial nerve number 9 and 10, glossopharyngeal and vagus nerve are functional and intact. Now we're going to be moving on to cranial nerve number 11, which is the spinal accessory nerve. Okay, so just I want you to shrug. Okay, turn towards my hand. Turn towards my hand. Perfect. So, spinal accessory nerve is functional and intact, and no signs of weakness on when he was on his shoulders, when he was shrugging, or when on the sternocleidomastoid and mastoid muscle when he was turning his head. Okay, so now the final nerve is hypoglyceal nerve. So I just need you to stick your tongue out. Okay, tongue is midline. Now I want you to poke out your cheek with your tongue. Other side. Perfect. So cranial nerve number 12, hypoglyceal, is functional and intact. No signs of drifting, no signs of trauma or anything like that. So cranial nerve, all 12 cranial nerves are functional and intact. So after we're done with the cranial nerves, we're going to work on the cerebellum, which is also called the balance area of the brain. Okay, so I'm going to have you stand up, please. Okay, close your eyes. This is going to be the Romberg's test. We're assessing for balance. So close your eyes. Okay, hands to your sides. Perfect. Okay, no signs of leaning, no signs of falling towards one side or the other, no signs of favoring one side or the other. He's standing completely fine. Okay, and his ability to stand is completely fine. Okay, put your hands like as if you're holding soup. Okay, in supination position. Okay, this is called pronator drift. Okay, there's no trembling in the arms, no sign. There's no tremors. There's no signs of the arms folding onto themselves and going into pronation. There's no signs of leaning to one side or the other. Okay. All right, so both Romberg's test and pronator drift are functional and intact. Okay, so I need you to walk towards the door and then walk back. Okay, perfect. So the gait is functional. There's no shuffling gait, no signs of favoring one foot or the other, no signs of instability. Okay, I'm sorry, buddy. I'm gonna need you to walk on your toes now.
Okay.
And okay, same thing. Walk towards the door. Walk back. Okay, perfect. Now walk on your heels. Walk back. Perfect. Okay, you can sit down now. Okay, so all 3 walks, both normal gait. Okay, no signs of shuffling. No, when he's walking with his toes or his heels, no signs of favoring one limb over the other, no signs of weakness in any of the extremities. Okay, so now we're going to be moving on to the sensory part of the test. Okay, so I want you to close your eyes and open up your hands to me. Okay, I'm going to be writing a number on your hand palms, and then I'm going to ask you what number it is.
8.
Perfect.
8.
Okay, perfect. So gravisthesia sensation is normal and functional, and no signs of abnormality. Okay, so now we're going to assess for joint point. Okay, so I'm gonna have you hand going up and down, fingers going up and down, and then you just tell me which direction, up or down. Okay, close your eyes.
Up. Down.
Perfect.
Up. Down.
Okay, and now with your legs.
Up. Down.
Perfect. Other way.
Up. Down.
Perfect. Okay, so joint point test displays functionality, able to function and differentiate between up and down directions. Now we're going to be doing the 2-point test. I'm going to have 2 items, okay, and then you're just going to tell me if you feel them both. Okay, we're going to be doing this on all extremities. Okay, so
2. 1. 2. 1. 2. 1. 2. 1.
on your legs.
1. 2. 1. 2.
Perfect. So a 2-point test displays normal sensation with all extremities. Okay. Now we're going to be assessing for vibration sensation. Okay. So similarly, what we did with the mastoid bond, I'm going to put the tuning fork on your extremities, and you just tell me if you feel the vibration. Okay. Close your eyes.
Yes.
Okay.
Yes.
Perfect. Okay. Okay. Now I'm gonna do it to your legs. Feel the vibration?
Yes.
Okay.
Yes.
Perfect. So vibrations were sensed in all extremities adequately, no signs of distress. Okay. So now we're going to be doing tactile versus sharp. The same thing like we did with the facial nerve. We're going to use the pen as the sharp and the cotton tip as the dull. Okay, and just tell me if you feel them. This will assess for pain sensation and tactile sensation. Okay, close your eyes. Okay, so what do you feel?
Dull.
Perfect. And what do you feel?
Sharp.
Perfect. What do you feel?
I can do it in. Dull.
Perfect. And then what do you feel?
Sharp.
Perfect. Okay.
Dull.
Okay.
Sharp.
Perfect. Okay. I think that's good.
Dull.
Perfect.
Sharp. Dull. Sharp.
Perfect. So tactile sensation and pain sensation was adequate and functional. Okay. All right. Now we're going to be moving on to the motor sensation system of the neuro exam. Okay. So I'm going to have you curl your arms. Okay. So now you're going to pull towards yourself. Okay. Bicep is 5 out of 5. Okay. In strength. Now push. Okay. Tricep is 5 out of 5 in strength. Okay. Now with your with your hands to your side. Okay. Open your arms. Perfect. Okay. Deltoids are 5 out of 5 in strength. Okay. Now put your legs down. Okay. So you're gonna lift your legs. Perfect. Okay. So quads are 5 out of 5 in strength. All right. Now I'm gonna ask you to pull back. Okay. Hamstrings are 5 out of 5 in strength. Okay. Now we're gonna test your hip abductors and adductors. Okay. So abduction would be the hip going away from the midline. So, okay, try and put your leg. Perfect. Okay. So he was 5 out of 5 for the hip abductors. Now adductors is going to be towards the midline. So I'm going to try to force your feet, your knees together. Yeah. Okay, perfect. And 5 out of 5 on the hip abductor. Sorry. Okay. So now we're going to be testing your reflexes, starting with the bicep. All right, so I'm gonna hit your deep tendon reflex, bicep reflex, and you're gonna feel your arm jump up. Okay, it's totally normal. Perfect. Okay, the other side. Okay, ready? 1, 2, 3. Perfect. Okay, so the bicep deep tendon reflex is 2 plus. Okay, now try time to do your tricep. Okay, again, the same thing. You're gonna feel it jump, okay?
Yeah.
Perfect. Okay, other side. Okay, perfect. So tricep, bilateral triceps are 2 plus. Okay, now we're going to be doing patella. This is the one that you always see. Doctors doing like this way, look up. Look up. Just relax. Okay, and then it's just gonna jump up on itself. Okay, this is the patella reflex, deep tendon reflex. Perfect. Okay, and then the other side, you can relax. Just relax. Okay, and the patella reflex. Perfect. Okay, it feels a little weird. So the patella reflex is also 2 plus. Now we're gonna move on to the Achilles reflex. Okay. All right. So on the Achilles reflex, we'll be hitting the back, the Achilles tendon, of course, and then the feet will jump up.
Okay.
Okay. Ready? 1, 2, 3. Perfect. Opposite leg. Okay. Ready? 1, 2, 3. Okay. Perfect. So patella and Achilles tendon deep reflexes are 2 plus, functional and intact. Now we're going to be assessing, okay, for Babinski, which is normally not going to be, it's going to be normally negative unless there's some neurological issue. So what we are assessing for is when I write an upside down J on his palm of his foot, his feet would, if it's a normal finding, it should go downwards and curl down. If it's an abnormal finding, it would curl up, okay, like a fan. Ready? Sorry. Yes. So Babinski was negative. Okay, the other side. Ready?
Yeah.
1, 2, 3. And they curl down. Okay, perfect. Babinski was normal too. Okay, so that concludes the neural exam.
Thank you.
Okay, thank you so much. If you have any questions, let me know.
No, thank
Okay,
you.
perfect. That concludes our neural exam. Thank you so much.